Compress DME, better circulation for a better life. Chronic venous insufficiency is a circulation problem that affects the veins in your legs. Your veins carry blood from your feet and legs back up to your heart. Inside the veins are small one-way valves that help push blood upward. When these valves become weak or damaged, the blood does not move up properly and begins to collect in the lower legs. Over time, this pressure can cause swelling, skin changes, discomfort, and wounds that may be slow to heal. Inside the veins in your legs are tiny one-way valves. These valves open to allow blood to travel up toward your heart and then close so it does not fall backward. Your calf muscles act like a natural pump. Each time you walk or move your ankles, the muscles gently squeeze the veins and help push the blood upward. With chronic venous insufficiency, the valves stop closing the way they should. Instead of moving upward, some of the blood falls back down and collects in the lower legs. This creates extra pressure inside the veins. That pressure pushes fluid out into the surrounding tissues, which leads to swelling in the legs and ankles. Chronic venous insufficiency is very common, especially after age 60. It often develops in people who spend many years standing or sitting for long periods of time. It can also occur after leg injuries or blood clots, and is more likely in those who have had long-standing leg swelling or previous vein problems. Many people who have it did nothing wrong. It is often simply a part of how the veins change with age. The symptoms usually appear slowly over time. Many people notice swelling in the legs, along with aching, heaviness, or tiredness, especially later in the day. Shoes or socks may start to feel tighter by evening. Often, the legs feel better when they are raised up, but the swelling returns after standing or sitting again. Over time, the extra pressure in the veins begins to affect the skin. The skin near the ankle may become darker in color and may feel dry or itchy. It can also become thicker or firmer than normal, and the area may be tender or sensitive to touch. In more advanced cases, the skin can break down and form an open sore called a venous leg ulcer. These wounds most often appear near the ankle and may drain fluid or take a long time to heal. Without proper care, they can close and then reopen again. Raising the legs can help reduce swelling for a short time, but the swelling often comes back once the legs are lowered. This happens because the vein valves are no longer strong enough to move the blood upward by themselves. Treatment is aimed at helping blood move out of the lower legs and reducing pressure inside the veins. Your healthcare provider may recommend compression therapy as part of your care plan. A soft sleeve is placed around the foot, ankle, calf, and thigh, and gently fills with air in a slow, timed sequence. This action helps move fluid and blood out of the lower leg and back toward the body. When used as directed, it can help manage swelling and support the skin's natural healing. For patients who have a venous leg ulcer, improving fluid movement and reducing swelling are important parts of wound care. Controlling swelling helps protect the skin and supports the body's healing process. If you notice ongoing leg swelling, changes in the skin around your ankle, or a wound that is slow to heal, talk with your healthcare provider. With proper evaluation and care, chronic venous insufficiency can often be well managed. Early care can help reduce the risk of complications and protect the health of your legs.